This lady, whose name and identity have been concealed, says her troubles began in her senior six vacation.
The man fell in love with me and I conceived. I got the nurses who asked me to test for HIV. So when I tested, I went reluctantly, not knowing my status, but after the test is when I was disclosed that I had HIV.
29 September 2011 is the day she says would haunt her for the rest of her life.
I got another man because the other one left me because of my status and the pregnancy. The time of labor pains also came. That was in now Soroti Regional Referral Hospital. The doctors said, you are due for a Caesar.
For 5 years now, she cannot conceive because a doctor at Soroti Regional Referral Hospital sterilized her without her consent. It's a family planning method that permanently deprives a woman from getting pregnant.
So they cut my tubes when I didn't know anything. So after, in fact, 2 years down the road, we were not in good terms with my mother because they consented and I was like, how could you do this to me? Because I also had my own right to decide for myself. Why did you consent on my behalf?
And as I listen to her ordeal, she is inconsolable as tears begin to roll down her cheeks.
It is quite difficult. You know, you are HIV positive. Who else will want me? And I don't produce. At least another man would come in and say, I will also get my children, much as she is positive. But you have this man, and you're bound to lose him any time. He's going to look for another woman who can give it a child, much as he knows himself is positive. So it's quite difficult.
She's among a scores of women who were sterilized without their consent.
Bawange yatabuka nawulira nga yechaye nga tachanjagala olwokubanga bankutulaki enseke kubana ye mama we yali yafa mama we bwafa nga ayagala okuzaala omwana kubana linzadde abaana basatu naye nga balenzi kati ate nga ayagala okuzaala omwana omuwala amubulamu mama we.
Anytime I'm losing my husband, he does not want to listen to my side. He does not understand how it came about. Maybe he thinks I consented. So for him, he wants a child.
The permanent secretary in the Ministry of Health, Dr. Asuman Lukwago, says it's only in exceptional circumstances that women are sterilized.
There are some situations where doctors can make a decision on behalf of the patient, especially when subsequent pregnancies may cause a threat to her life. You go into a womb, you are going to operate someone who has got a ruptured uterus, and the uterus is severely ruptured. It can't be repaired. It has to be removed. The client can complain, but the doctor will be exonerated after he explains the circumstances. The doctor has to do anything in the process of saving the life of a patient, especially the patient who is incapacitated.
However, Dr. Lukwago says the government does not have a policy to sterilize women.
There is no program to sterilize HIV patients. Let me stop her from delivering, and the woman discovers without her consent, I think she could be having, the doctor may be having a case to answer.
A research conducted by the International Community of Women Living with HIV and AIDS, Eastern Africa, in 2014, revealed that women are being sterilized without seeking their consent.
We realized that of the 700 women that were being interviewed, 72 had been sterilized. But out of the 72, 20 were either forced or coerced into the act. And of the 20, 18 of them, they were sterilized from the government health facilities. Only 2 were being sterilized from the private health facilities.
Because sometimes the pregnancy may not go into the uterus. It can go into the tube. Because it can't grow into that restricted tube, after some months the tube will rupture. So when it does rupture, then the doctor will go to save that mother, and in the process he may find another tube also is vulnerable to get another tube of pregnancy. So sometimes you take a decision. But the routine sterilization should involve a patient. The patient should be counseled, and then she accepts.
Through this human rights organization, about 25 women are planning to seek legal redress.
Because here you're putting a stop to someone not to bear any other child. So they really have a lot that flows into their minds, and they're looking for psychosocial support. And then others, they want to take a legal action. They want us to go to court and maybe government compensates them.
This research was conducted in 9 districts of Uganda, as there fears that the problem is widespread.
Yes, we are talking about the 9 districts, but there are also other districts where it is happening, but because people have not come out to speak about it.
Jingo Francis, NTV, Weekend Edition.